We understood as an organization that we needed to change the way we do care, that this was all about care transformation. We knew that we needed a tool that was going to say, okay, it's great that you're measuring, what are you going to do about it? And what is it going to take to have a tool that's going to drive change?
Seattle Children's Hospital is testing a new way to manage patient care. It's a shift from traditional hospital-based care to a value-based population health model that reassigns responsibility for care management to teams of nurses and care coordinators. For the model to work, the hospital needed a new tool that could handle tasks as different as care management, metric measurement, and claims. There were also practical challenges.
So the tool had to be something that was quickly understandable, easier to use, easy to apply to the setting within the private practices.
And like all members on the caregiving team, all components of the tool need to work together.
There are a number of tools out there that will tell you they are a care management and a measurement tool. They aren't integrated. They often may sit side by side, but you aren't able to connect your claims data with your care management measurements and with your ability to drive care. So Wellcentive bubbled up very quickly as the most integrated tool that we looked at.
And the Philips Wellcentive tool is clearly better suited for population health.
Other tools talk about care management, they're really more utilization review. They're built from a more payer perspective. They support the concepts of trying to drive down utilization, but not so much the concepts of changing behavior, addressing social determinants of health, and Wellcentive did that better.
The decision to select Philips Wellcentive paid dividends at once.
We immediately saw a threefold increase in our ability to enroll families much more quickly, and our trajectory has just gone straight up. And why is that? Well, a couple things. We were able to standardize the process. So there are standard tools that every staff uses. The tools are easy. They're just simply selecting boxes. You can select and say, I want to talk about this, or I don't want to talk about this. So I can, as a manager, build a comprehensive tool that covers everything, but the staff aren't burdened by having to answer every question.
Another advantage is that Philips Wellcentive coordinates the efforts of every caregiver.
We have, at least three people in taking care of these children. So being able to have everyone see what everyone is doing and knowing what the next task is with a child, irrespective of who that care team member is an important piece. So Wellcentive certainly supports our ability to do that.
Another reason for its success is the enthusiasm of those who work with Philips Wellcentive every day.
And I think the telling point was my staff, after about a month after we went live, who turned to me and said, oh, this has made our job so much better. It's easier. We can communicate with each other so much better. We can PDCA, we can change our tools and have them be implemented in the moment so that we can affect our work personally and as a team. So a tool that has your staff saying, this is great, is a gift.
But even more importantly, Philips Wellcentive allows the network to demonstrate results in ways that matter most.
And we've already seen improvements in the quality of life for children in 6 months into this program. And so that's a significant outcome. An improvement of about 4 points is significant. We have about a 10-point improvement. So while it's early on in our program, it is an outcome. It's not a process metric. It's great that we're providing care management. It's great we can say everyone has a care plan. But if we aren't impacting their quality of life, if we aren't impacting their cost of care, then we're no different than anybody else.
Philips Wellcentive's reporting and analytic capability is helping to validate the new approach.
They actually be able to see results, track results, present results of this care coordination activity is in itself a monumental achievement. We will be prepared to actually change how care is delivered, reduce costs, and at the same time improve the quality and outcomes of our patients. So we could actually say, yeah, we're making a difference. And that's a huge step.